Before you begin mouth care, it's important to have everything you need on hand. Good quality, well-fitting medical examination gloves, either vinyl or latex, as you will be dealing with saliva, viruses, and frequently with blood. Food handler gloves are too loose and will leak and can tear easily. A mask and protective eyewear are important if there's risk of splatter. A paper cup and water for those able to swish and spit, and something for them to spit into. And a towel to drape around the individual's neck and to help clean up both during and after mouth care. You could also use a plastic drape to help keep them clean during mouth care. And a dampened disposable cloth or clean face cloth to wipe out the mouth as you go along. And a water-based lip lubricant such as Labello, KY Jelly, or Biotene Oral Balance to use before and after mouth care. A soft bristle toothbrush to effectively remove plaque while still being gentle enough to use at the gum line and on other mouth tissues, like the inside of cheeks, roof of mouth, and tongue. A toothpaste with fluoride. Fluoride helps to remineralize and strengthen weakened tooth surfaces. For residents with dry mouth or swallowing issues, a fluoridated toothpaste without detergent, such as Biotene or Sensodyne F Brilliant Whitening. These products produce less foam and don't dry out mouth tissues. You can keep lip lubricant and toothpaste handy during mouth care by loading just a little bit on the back of your glove. Depending on the resident's needs and their ability to cooperate, some tools for cleaning in between are floss and a floss holder to use where space between teeth is tight. Where there are open areas between the teeth, you can use a Proxibrush. And for tongue cleaning, either a toothbrush or a tongue cleaner. And use a waterproof marker such as a Sharpie to write the individual's name on all of their products.